Gloves off. Gloves have been the most procured item since the start of the pandemic and are sourced almost exclusively from Asia. Prior to the pandemic, on average, we distributed 5 million gloves weekly for use in health and social care settings. During the pandemic, this rose to 10.8 million gloves, which we know were often worn inappropriately. That amounts to over 1.2 billion gloves being issued to health and social care settings since 1st of March 2020. As gloves are single-use items made of synthetic rubber and can't be recycled, we need to make sure that we're wearing them for the right reason. Gloves play a key part in infection prevention and control. As part of standard infection control precautions, we use gloves in healthcare to reduce our potential risk of exposure to blood and body fluids, which can contain harmful bacteria. This helps to keep you safe from any potential infection risks. However, we need to be careful not to overuse gloves, as this can cause problems such as skin irritation, potential cross-infection, including those infections which are resistant to antibiotics, and poor hand hygiene, as overuse of glove use discourages people from regularly washing their hands. The National Infection Prevention Control Manual gives clear advice around when disposable gloves should be worn. Standard infection control precautions are basic principles which should be used by all staff in all care settings at all times for all patients, whether infection is known to be present or not. The use of PPE, including disposable gloves, is based on risk and the likelihood of exposure to blood or body fluids such as urine and faeces. This ensures that the PPE worn provides adequate protection against the risks associated with the procedure or task in hand. For education around how to translate the National Infection Prevention and Control Manual into practice, see the Scottish Infection Prevention and Control Pathway, SIP-CEP, which is aligned to the National Infection Prevention and Control Manual. And importantly, through appropriate glove use, we will all play a part in achieving NHS Scotland's aim to be a net zero greenhouse gas emissions health service by 2040 or earlier. We will reduce demand for raw materials. We will contribute to the regeneration of natural systems. We will reduce waste. We will design out pollution. This all creates a significant carbon footprint. And as gloves can't be recycled, using them effectively and only when necessary helps us reduce this footprint. So remember, appropriate use of disposable gloves protects you from potential infection when there is a likely exposure to blood or body fluids. However, wearing gloves when there is no risk of blood or body fluid exposure can actually cause harm to you and our patients. Gloves are easily contaminated, so regular hand hygiene is the best way of reducing risk of infection to yourself and your patients. Avoiding overuse of gloves prevents unnecessary waste and environmental damage. Protect ourselves and our planet.